Let's move on to the chapters that are given in the ICD 10cm manual. So these 10 chapters are arranged in this format, and here what you should know is like each chapter or each system might have a specific code. During the exam, there is no point that you will have to go and check for every diagnosis code. No, if you do that, the time elapses, the time passes away. So don't do that mistake. So what you're supposed to do is, unless it requires that for you to go and see in the tabular list and select the specific code, that is okay. Otherwise, what you should know is like, you should know the general arrangement of the codes, because you have these options in your codes actually. You have these options which contain the codes. So if you know what an S code is, what a T code is, what a V code is, what a G code is, then you can very well understand. Say for example, the patient is coming for colitis, then you should know very well, okay, the code is colitis. So colitis is something with the digestive system. So digestive system starts with the alphabet K. So in that case, you should know that. So your first diagnosis, your option should be the code that has the digit or the letter starting with K. If you have like L or M or N, it makes no sense. That is not the right answer. So this is how you will have to eliminate it. For ICD 10cm, what is all the more important is, you should know the codes, which K codes or L codes or M codes, what chapters are they or which system they belong to. Next is like, what is a general coding guideline about it? Because when you know the guideline and the general format of these codes, then you don't have to go and check for every DX code in your ICD 10cm manual, because you don't have time to do that. You will have to simply see the options and try to eliminate it. At first do that. If you are unable to do that, then you can very well go and see into your ICD 10cm for doing the final confirmation. The first chapter is infection. How you need to remember is like A and B infection. A code or a B code will have the codes for bacterial infection, viral infection, parasitic diseases. Any diseases, be it fungal, parasitic, viral or bacterial, all those diseases will start with the alphabet or with the letters A and B. Next, neoplasms. See, tumors, you should know either C or D. C is for cancer. C for cancer. So malignancies will start with C, and D, benign neoplasms or in situ neoplasms, would start with D. This you should know. AB is for infection, C and D, C is for cancer, D is for benign neoplasm. Next, coming on to D, D will also go for blood, because essentially you need to think of like tumor is in the blood. So blood or any hematopoietic conditions like anemia, pernicious anemia, leukocytosis, all those would be with the letter D. Next is E for endocrine. Think of diabetes. Diabetes mellitus is E11.9, an unspecified type of diabetes. So diabetes is a metabolic and an endocrine disorder because of disruption of the pancreas. So all endocrine disorders start with E. Say morbid obesity. Next is mental. Mental means anything with psychiatric or behavioral disorders would start with a F. Next, if you see, nervous system diseases will be with G. Pain and nervous system would start with G code. See, for example, we saw this, etiology and manifestation code. We were talking about Parkinson's dementia. So dementia is a mental disturbance. Dementia is classified under the mental disorder. Dementia will have the F code. Okay. But we also know the rule, like when a patient has dementia, you should code the actual reason for dementia or the underlying disease or the etiology, which is Parkinsonism here. Parkinsonism is a disorder of the nervous system. You will have to assign a G code for Parkinsonism. Actual sequence would be here, because when you are coding an etiology and a manifestation code, the first code should be the underlying disease. Here the underlying disease is because of Parkinsonism, which is a G code, and the manifestation code is dementia, which is a F code, so that is of the mental. So your sequencing, your first should be the G code and then the F code. I hope you understand this, because you all know the mental is the manifestation thing, so that should be secondary, and the actual cause is Parkinsonism, which is a nervous system disorder, and nervous system begins with the letter G. It should be G code followed by the F code. Of course, pain all will come under the G category. All disorders of the eye and ear will have the letter H. This is pretty straightforward. And I would come under the cardiovascular. For example, I10, hypertension is actually a vascular problem is with the blood pressure, right? So it is with the blood vessels. So it is cardiovascular. So I would be this one, cardiovascular. J would be like, take for instance, asthma. So think of one code. You remember, try to remember one code. Say for example, B, I can say like B20, which is AIDS. C is for cancer. D, neoplasms. Blood also anemia, D code. Endocrine, E11.9. F is dementia. G is Parkinsonism. H is any instance like, we can have say like there is obstruction to the aqueous canal or glaucoma. That would be a H code. Ear code will also be the tympanic membrane perforation would also be a ear code, that is H. Cardiovascular, I10, hypertension or myocardial infarction. J is asthma or any chronic rhinitis. And digestive system will all start with K. Polyps, polyp of colon. Next comes L. Skin will have the L code. M is pretty simple, musculoskeletal. N is genitourinary, kidney stones, renal stones. Okay. Next O is obstetric, pregnant state. So all O codes take sequencing priorities, that you should know. Next P is for the perinatal, Q is for the congenital, and R is for the signs and symptoms, dizziness, vomiting. So all comes under abdominal pain, constipation, all comes under R. So you should know sequencing of conditions. Say for example, they are establishing diagnosis colitis, patient presents with abdominal pain. You will have to report only colitis if the cause of abdominal pain is colitis. Now colitis, it starts with the letter K. So your option should contain only the letter or the diagnosis code with K. You are not supposed to include the diagnosis code with the letter R because abdominal pain is an integral symptom of colitis. Next comes injury and poisoning. It is with S and T codes. Strain, sprain, fractures, and then injury, that is an acute injury, all the fractures, and complications, adverse effect, poisoning, all with S and T, complications. Next you have this external cause codes like S and T is over. Z will come under the health status code, will report as a health status reporting, encounter, screening and all that. Remaining other than Z and S and T, we have this V, W and Y. These are all the external causes of codes reporting. With this, I think you will have a very good understanding. You don't have to go on, verify each and every code in your ICD 10CM during the exam, because I am not saying every time you should not do, but for certain instances, you can very well see the options. If you by heart, you need to by heart this A, B, E, D, F, G, which all codes, which all system. When you read your question, what is the symptom or the condition patient is presenting with, then automatically your mind should actually pick the code, whichever is starting with F, G or H or I, J, K. If it is something starting with I, that means there is a cardiovascular problem. If it is something with L, say take for instance like actinic keratosis, it starts with L. Very simple. But if it's going to be a cancer of your forehead, it should start with the C. C44319 or a C44329. It goes this way. Please memorize these alphabets of each of these chapters, and this will help you to make your answer your attempts very quickly during your exams.